Okay, so I'm going to cover environmental factors and social factors, that's B3 and 4, in hopefully just under 5 minutes. So we'll start with environmental factors. So the environmental factors are linked to where an individual lives or the area they inhabit. The main impact or main influence on our health is pollution. Now, pollution can come in a number of ways. We've got outdoor pollutants and indoor pollutants. Outdoor pollutants would be traffic fumes, industry smoke and pollution, pesticides, commercial waste, and building site waste, and issues like asbestos and chemicals that are released there. Indoor pollutants, that would be stuff in the home, so that could be cleaning chemicals, aerosol sprays, cigarette smoke or secondhand smoke, mold and bacteria, and carbon monoxide. These would all be pollutants that have an impact on the body. The main impact of the pollutants would be respiratory disorders like bronchitis, asthma, emphysema, or lung cancer, cardiovascular problems like artery blockage, heart attacks, and it can be linked to allergies like wheezing, rashes, and allergic reactions. But what I found, just talk about exams, exam papers, when they ask about the impact or the influence of pollution on the body, allergies don't really get credited. So really I'd stick with the first two: respiratory disorders, cardiovascular issues, and cancers. Poor housing also has an impact here. So obviously it has an influence on our health. So these can be short-term and long-term. So poor ventilation and damp in the home, that can lead to mold and respiratory issues. Overcrowding in the home can lead to anxiety, depression, and the spread of illness. Lack of heating can cause hypothermia. And a lack of outdoor space means that you can't do any exercise, and that can also then influence or lead to cardiovascular issues. And lastly, poor sanitation. So this does overlap a little bit with the spread of illness, but poor sanitation in the home can lead to more risk of infections. And last but not least, for environmental issues, we have the barriers to care. So some set of barriers linked to service availability. So where people live in location to geographical area, they may be far away from services or lack access to support. There may be no transport, the opening times of services may not be sort of meet their needs. There could be high demand on a service during particular times like winter and flu epidemics, and that can put pressure on the service and mean that people can't get the services they need. Individual circumstances also have a role here, so mobility restrictions, learning or communication barriers, awareness of the availability of help, and also personal life issues like providing care, work, can also provide a barrier to care. And then we have social, and I'm going to put cultural factors in with this. Now, social factors focuses on the role of the family, the social interactions we have, and some cultural influences and how these affect our health. The first one of these is dysfunctional families. Now, a dysfunctional family is a family that does not do its job. It is not doing its job properly. It is dysfunctional. So members may not perform their function. Members display negativity towards one another. There could be sibling rivalry and conflict, abuse. And all of this could be caused by parental upbringing. So if parents have been brought up in dysfunctional families, they're more likely to have them themselves. There could be mental illness issues, alcohol and drug abuse also have a role to play. The effect of dysfunctional families on health could be stress. It can lead to isolation, health issues, guilt, psychological harm, and mental health issues, and drug and alcohol use. So they can affect our health as a result of being involved in these dysfunctional families. Parenting style has a role to play in this. And there are lots of different types. So you've got supportive, unsupportive, demanding, and undemanding. So if you have a supportive, demanding parent, they're authoritative. The children often have high self-control, high self-esteem, and are confident. Supportive, demanding and unsupportive leads to authoritarian parents. So poor social skills, low self-esteem. Undemanding and supportive means that children are self-confident, they're impulsive, and they may have difficulty making friendships. And then disengaged and uninvolved parents are undemanding, unsupportive, and the children have low confidence, self-esteem, and poor attachment. Bullying also has a role. It causes stress, withdrawal from social activities and education, anxiety, eating disorders, self-harm, stress, and poor achievement. And in religion and culture also has a role, because mainly it's dietary restrictions like fasting, influences on medical intervention. These affect lifestyle and health. This is all very, very brief as an overview. I'd say definitely go back and look at them, but just to remind you what came up in the topic. And there we have it.